Thank you, sir. Thank you for agreeing to chair this important session. And I agree, 30 minutes is definitely not enough when we want to talk about patient experience. And as we were discussing that, on the outside, patient talking about patient experience looks a very simple thing, but it's like studying moral science. दिखने में it's very simple कि हाँ ऐसा करना चाहिए वैसा करना चाहिए, but when you start digging, I can challenge you, you will not find the bottom of it. So thank you once again, and a warm welcome to all the panelists and everybody who has come today and taken out time from their busy schedule for this conference and making it a success. Thank you so much. I'll start with an analogy. How many of you love cricket? I don't have a raise of hands compared to what it is on the ground.
Maybe after the New Zealand series on the heads are down.
So in that case, let's refer to the time when we had Tendulkar and Ganguly and all those. How many of you love cricket? I would say a lot of us love. How many of you love Test cricket? Less people. How many of you would love a one-day match? And how many of you would love a T20 match? अब ज़्यादा हाथ आ गए। अभी धीरे-धीरे सर 6 over a match भी आ रहा है। My point is, cricket being at the center of it, you would understand and relate how people would behave differently and how their experiences varying. A person would draw much more joy from watching a test match compared to another person who would not enjoy a test match but would like to see a 20 over match. Now from this analogy, let's come to the hospitals, let's come to the healthcare sector. It is a very vast topic, but I would like to give you an overarching theme of 3 P's, basis which we would agree that a lot of patient experience can be drafted into these 3 different baskets. One is place, second would be person, and third would be the pair. So let's talk about place a bit. We should and we would have to understand that the patient experience would differ from what he is expecting when he visits a government facility. And when we talk about private facility, his experience would vary when he would go to a community hospital or when he would go to a 500-bedded super specialty hospital such as like this. I'll give you an example, sir. We have a small 100-bedded hospital in Sector 19 and we like to call it a community neighborhood hospital. Whenever we are doing construction over there, वहाँ के लोग they get happy. The people who have been coming to that facility for the last 20 years. Why? We ask them, why are you happy? This is creating so much of noise. वो कहते हैं कि यार ये renovate हो रहा है. It is maturing. इसका मतलब हमारे लिए this facility is getting upgraded. Now come to this setup where we are sitting. This is a 500-bed setup, and people are coming from all over the country and outside India. However, एक छोटी drill से they would create a havoc कि नहीं यार, it is disturbing me, stop it. So that is how the patient experience is being differentiated. So we spoke about place, whether it is a government or is a private. Second is person. A lot of emphasis goes on to the patient. Many of you would agree, patient तो बीमार है, he is on the bed and is at the mercy of the clinicians and the nursing staff. वो नहीं देख रहा कि आजू बाजू पेंट कैसा है, F&B कैसा है, हाउसकीपिंग कैसा है, ग्रूमिंग स्टैंडर्ड्स कैसे हैं. It is the attendant who is with the patient. So we need to identify that when we talk about patient satisfaction, when we talk about patient experience, medical care is at the core of it और वो change नहीं हो रही, whether it is a government hospital or it is a private of any scale. But apart from that, it is the attendant who is judging a system basis his experience. How a nursing staff, when he or she is coming into the room, how is she talking? How the F&B staff is dealing with me? How a consultant is talking to me? And the third major P is payer. Who is paying for the patient? That also determines how much satisfied the patient is. If a patient is paid, as Dr. Clive said, a patient is very happy with the entire process, but when on the last day he sees his bill and he has to pay out of his pocket, it is natural that he will definitely feel a brunt on himself. So the payer, whether he is out of pocket or somebody else is paying for it. Sir, that is all to begin with. Let's start.
Okay.